Please make sure to only use the Sonosite machines with the large L38 linear transducer. You will then obtain 4 different videos of each wrist using the non-affected side as a control. Make sure to circle left or right corresponding to the injured side. The first view that you're going to get is the transverse dorsal view of the patient's distal forearm, as you can see here. Make sure to keep your probe perpendicular and drag it back and forth along the area of interest. The next view is the longitudinal dorsal view of the radius. Make sure the indicator is pointed proximally towards the patient's upper arm in this view. Also, make sure once again that you label your images. Next, obtain a longitudinal radial view of the patient's distal forearm. Make sure to roll the probe and adjust the angle to keep the bony cortex bright and white on your ultrasound screen. It's also important to adjust the depth to about 2 centimeters to give optimal viewing of the radius and to keep the epiphysis on the right 1/3 of the ultrasound machine screen. Finally, obtain a longitudinal volar view or palmar surface view of the patient's arm. Only do this view if manipulating the patient's arm will not cause significant pain to the patient.